Hi everyone, this is Section C, Interpreting Medication Orders and Drug Labels. So for this section, you're going to learn how to correctly interpret medication orders and drug labeling, which is critical for safely administering medications. You're also going to learn components of a complete medication order and drug labels, as well as guidelines to correctly document medication administration as presented. So these are your objectives. Upon completion of this unit, you guys will be able to read and interpret component of a drug label, identify and interpret a complete medication order, recognize the difference between a routine or standing order, a one-time order, a stat order, and a PRN order, properly document the administration of medications, and correctly calculate the number of tablets, capsules, or volume that are required for a prescribed dose of medication based on the order and the drug available. So these are your assignments. So you have Section C ATI Med modules assigned in Canvas. Also review the language of prescriptions and orders, military time as discussed in Section B. Also time abbreviation, routes of administration and abbreviation, drug labels. Optional reading will be your Med Math textbook, Chapter 3, pages 52 to 72. Military time. So we already talked about military time previously on Section B, but you can use this as a review. Please read them carefully. You can use this table. Whatever works for you, that's okay. Now let's talk about time of administration abbreviation and what kind of orders are they. So based on your objectives, you want to know what a standing or scheduled order is. So let's talk about this first. So here, these ones you have to absolutely know. So you have to memorize this. Let's start with AC. AC is before meals. PC, after meals. Daily, QD or Q point D point, it means every day or daily. Now, because of possibility of medication errors, when it comes to this, ideally, it should be written as daily. You're not supposed to use the abbreviation anymore. So instead of writing the abbreviation for daily, you write it out. BID is twice a day. TID is 3 times a day. QID is 4 times a day. QH is every hour. HS or H.S point is at bedtime or hour of sleep. Now this should also be written out as it can get confusing with the Q hour. So it's always better to write out instead of HS, write out at bedtime. Stat means immediately. Q2H is every 2 hours. Q4H is every 4 hours. Q6H every 6 hours. Q8H is every 8 hours. Q12H is every 12 hours. So definitely, and so on. So it can also be Q24H, Q24 hours, etc. Now QOD or Q.0.D is every other day. Again, just like the HS, this should be written out instead of writing the abbreviation. So ideally, you want to write it out as every other day. Now, PRN is as needed. TIW or T.I.W should be written out. So it means 3 times a week. BIW or B.I.W point is twice per week. So which ones are scheduled or standing? So scheduled or standing are basically schedules that don't necessarily change. So basically those are the things done the same time, the same way every time. So based on the time of administration order, your scheduled or standing orders would be this ones right here, your AC, PC, your daily, BID, TID, QID, every hour, at bedtime, every 2 hours, every 4 hours, etc. Every other day, 3 times per week, twice per week, and so on. Now, what are your stat orders? Well, we'll talk about it. So this is the stat order. Basically, stat order is a one-time, right away, or immediately order. So you have your stat. So that's a stat order. And a PRN order is basically a medication that's only as needed. So you don't have to administer it around the clock or every time. So you can have a medication per se that's scheduled Q2 hours PRN. So the difference between that and just Q2 hours alone is that the Q2 hours scheduled medication, you have to administer it every 2 hours no matter what, based on the order, right? But when it comes to PRN, Q2 hours PRN, meaning you can give it every 2 hours if needed. So an example of that would be your every 2 hours as needed for pain. So let's say acetaminophen every 2 hours as needed for pain. So if the patient is in pain, you can administer it every 2 hours. Now, does it mean that you have to give it every 2 hours? No, because if the patient is not in pain, then you don't have to give it. And then a difference would be acetaminophen Q2 hours per se. For some reason, the doctor ordered Q2 hour administration of acetaminophen. Regardless of what's going on with the patient, whether the patient is in pain or not, you will administer that medication. Now, that would actually be a little questionable for me if I receive that order, because usually it's not given just like that for no reason. But basically, that's the difference between Q2 hours or a scheduled or standing order versus a PRN or as needed order. Now, let's talk about route of administration abbreviation. So you have AD, right ear, AL, left ear, AU, each ear. Now for this, for the left, right, or each ear, this needs to be written out just because of a possibility of error. So just to be clear, when it comes to left, right, or each ear, it needs to be written out instead. Now, HHN, handheld nebulizer. IM, intramuscular. IV, intravenously. IVP, intravenous push. IVPB is intravenous piggyback. MDI is meter dose inhaler. NEB, nebulizer. NGT or NG, nasogastric tube. OD is in the right eye. OS in the left eye. OU in both eyes. Now, same with the ears, this should be written out. So, if the order needs to be in the right eye instead of using OD, it should be written as right eye. So again, for OD, OS, OU, this is no longer a standard, so we shouldn't be using it. Instead, it should be written out. PO, either capitalized or small letter POs, it means by mouth. PR or PR, small letters PR or capital letters PR, in the rectum. Sub-Q or subcutaneously, or SQ, means subcutaneously. Now, we're no longer using SQ, small letters, S.C. or S.Q. Because of possibility of medication errors. SL means sublingual or under the tongue. SNS means swish and swallow. So reading medication labels, it is also very important to know the routes of medication administration. So you have different ones. You have the enteral or parenteral as discussed previously. So let's start with oral medication. Oral medications, so the medications come in different forms. We discussed tablets before. So tablets are pills that are solid. They can be split in half if they have a score. So remember the line in between, in the middle of the pill. So this is an example of a scored tablet over here. Now, if they're not scored, then these tablets cannot be cut into smaller pieces. these are examples of capsules. So capsules can be capsules containing powder and capsules containing liquids. Now, when it comes to capsules, they shouldn't be broken into smaller pieces. So you can't administer, let's say, half a capsule because it's really hard to make sure that it's an accurate measurement. And so for safety, when it comes to capsule, they're basically in whole numbers. It's either 1 capsule, 2 capsules, etc. There's no such thing as administering half a capsule, whether it's liquid or powder. Now, when we're giving medications, oral medications in the pill form, it is almost never safe to give more than 3 pills. Now, we understand also that sometimes there's no other available doses, so there's no higher doses, therefore we need to give more tablets or pills. That being said, if in question, definitely it's important to know the right dosages of medications, but when it comes to that, if you think it's you're administering more than you should be administering, or really if you're just wondering if it's anything greater than 3 pills and it's not a common dose for that medication, definitely you need to clarify that. Again, most of the time, you want to try to give as less pills as possible, unless that's the only formulation or dose available. Definitely clarify with the provider. Other than pills or solid medications, sometimes medications can be administered on a liquid with a liquid form. It's more common in small children just because they have a difficulty swallowing solids or pills. And usually with children, syringes are used. So oral syringes, however, are not the same as the injectable syringes. So never use oral syringe to inject a medication, because definitely that's not meant for that. They're not sterile, and it can cause a medical error. So parenteral medications, so administering medications via a route that's not basically to the GI, through the GI system. Definitely read this section carefully. I just wanted to point out some important things here. So subcutaneously, so this is basically given in the fatty layer of the tissue under the skin. Now, the maximum amount of fluid an adult can safely be given through subcutaneous administration is 1 ml. Intramuscularly, or IM, so this is administration intramuscularly given in the muscle. The maximum amount of fluid an adult can safely be given intramuscularly is 3 ml. For a child, the maximum is 1 ml. Now, if the dose is larger than 2 ml in an adult, the deltoid should not be used. So you have to take in consideration the size of the patient, right? So is it a skinny patient? Is it a bigger patient? And also you wanna consider how much are you gonna give. So the higher the volume, you wanna consider you wanna give it in a bigger muscle. Now also another to consider is how thick is that medication. So is it gonna be irritating? So things to consider when administering intramuscular medications. Intravenous medications, that's a medication that's given directly into the vein. There are different types of syringes used for parenteral medications. So you have your 3 ml syringe. Here it says 3 cc. Again, we no longer use cc. Let me give you an example. So this is an example of a 3 ml syringe. Now, take note that some syringes have a minimum scale on one side. Make sure you're not using that to measure your medication, as that would be an inappropriate dosage. But that being said, I don't think they're using this kind of syringes anymore, or as often. At least I haven't seen one in like 5 years or so, just because of safety concerns. So again, pay attention to your syringes. So if there's two two scales, make sure that you're using the right one. Again, for the most part though, this is what you're gonna be seeing. Tuberculin syringe is a syringe that's used to measure smaller doses. Now, usually this is for doses less than 1 ml, although the syringe can hold a total of 1 ml. And sometimes there's also smaller doses such as the 0.5 ml. Let me show you how it looks like. So let me make it smaller. So this is a 1 ml tuberculin syringe, and this is a 0.5 ml tuberculin syringe. As you can see, this is 0.1. Now this can go to 0.11, 0.12, 0.13, etc. Now you also have the 5 to 12 ml syringes. Just remember that on each of these syringes, every 0.2 or 2/10 is marked. So be very careful not to misread a mark as a 1/10 of an ml. So again, be very careful. Also, sometimes that can vary depending on your manufacturer. So always check your syringes when you're measuring prior to administration. So these are examples. So this is an example of a 5 ml syringe. This is a 6 ml syringe, and this is a 10 ml syringe, and this is your 12 ml syringe. Now, occasionally, you will need a bigger syringe, so you also have your 20 ml syringe in case. Although this is not used often, you can still see it depending on what you're administering. So how do we measure dosages in a syringe? So to measure a dosage in a syringe, we must line up the top of the black rubber plunger exactly where the line that marks the dosage we want to administer. So an example is this one right here. Let me make it larger. So as you can see, you want to use this mark right here instead of this one. So this is another example. So in this one, so the top marker and then the bottom one. So we use the top one. So for this specific one, I'm not sure what medication is in the syringe, but if you want to measure how much they're administering, so we have 4. Again, each line is a 0.2, so 4.2, 4, and it looks like this is the third one, so it's 4.6 ml. Again, this is another example. So this is from a 12 ml syringe. So if you look closely, this is the top line marker. Now here is 10. This is another 0.2, so we're at 10.2. And then this is 10.4. So this medication is 10.4. So that's how much they're administering. So in this example, we have a 20 ml syringe. Most likely this is an old picture because it says CC over here. Again, we don't use CC anymore, but you have to pay attention to the markings. So if you look at this is 5 and this is 10. So the marking goes, so the big markings would be go by 5s. And if you look in here, 5, 6, 7, 8, 9, 10. Then you have 11 and 12. So here, this is not 10.2 or 10.4. This is actually 12 because each marking is equivalent to 1 ml. Each little marking over here. So again, if you can see here, it says 10. And over here, it's 11 and 12. So we measure based on the top line, top black line. So this is 12 ml. So make sure you pay attention to that. This one right here is a tuberculin syringe. Now, if you pay attention, if you look closely, I know it's really hard to look from your screens, but this is a total of 1 ml. So if you want to pay attention to the larger marking, so this is 0.60. Now each line is basically 0.01. So if you look at here, it's 0.612 and 3. Now to make it clearer, you can also count over here. So this is 0.20, this is 0.40, and if you want to count, this is 0.21, 22, 0.23, 0.24, 0.25, 0.26, 0.27, 28, 29, 0.30 again, and count so on. So as you can see, each little one is equivalent to 0.01 ml. So for this specific syringe and medication, this has 0.63 ml. Now let's move on to reading medication labels and calculating dosages. Again, as mentioned on a previous lecture, we have the trade name and generic name. So most labels will have both of them, and so make sure you pay attention to it. Usually the trade name is capitalized and the generic has lowercase letters. In addition, you have your dosage units. So units used whenever an order is written for the drug, either milligrams, grams, micrograms, etc. You also have the administration unit, so how it comes or how do they want you to administer. So commonly you have tablets, capsules, teaspoons, tablespoons, liters, milliliters, etc. Then you want to also know the concentration or dosage strength. This tells you what the relationship is between the dosage unit and the administration units. Because almost all drugs are ordered in dosage units but administered in administration units, we must have a way to convert from one set of units to the other. This is what the concentration of a drug allows us to do. Now, the total amount of the drug is contained in the package. So basically the whole thing, how much is in the whole package. One thing that's very important that sometimes people tend to forget is the expiration date. So all drugs have an expiration date on them, usually prefaced by the abbreviation EXP. You should always check that the current date is before the drug's expiration date before you give a drug to a patient. Now, this is part of your checks. In addition to checking, the right drug, dose, etc., you also want to make sure that the medication is not expired. So this is an example of a medication label. So if we're gonna look closely, Verolan, so that looks like the trade name. So Verolan is a trade name. Underneath it is the generic, which is Verapamil, HCl, or hydrochloride. Then it comes in the form of a sustained release pellet filled capsule. So it comes in capsule, and each capsule is 120 milligrams. So if it's asking you the trade name, it's Verolan. The generic name is Verapamil hydrochloride. Dosage comes in milligrams, and your administration units are in caps. So what's your concentration? So the concentration is 120 milligrams per capsule. So it's the amount of medication per pill or capsule. Now, if it's asking you of the total amount in the package, that would be 100 capsules. So this is another example. So this is Thorazine. So Thorazine is your trade name. Chlorpromazine hydrochloride is your generic, and it comes in a 10 ml multi-dose vial. So this is how it comes. So this is how it's supplied. It's in 10 ml, so in ml. Now, the concentration for this one is over here. It says that there's 25 milligrams for each ml. And on this one, if you can see, so this is the lot number. It's blank, but expiration. So usually there should be an expiration. This has been purposely erased just to make sure, it doesn't confuse the students whenever we're using it as an example. Because if, let's say, we used it a couple of years ago, then it would have been expired. But you need to also check your expiration. So this is another example. So Procan SR. Procan is the trade name. Your generic would be prokinamide hydrochloride. And let's see here, we have your expiration. This is not a very complete one, but it says here 750. So to be honest, I don't think they're labeling it this way anymore. But I'm assuming from here it's gonna be a 750 milligrams. But again, this is actually not a very good example. So it says here 750 milligrams. Now I believe that manufacturers are required to use the units of measurements instead of just writing 750, because 750 what, right? Although this is an example, this is not a perfect example. Again, this is another example. So you have Cleosin phosphate, so that would be your trade name. And here, let me make it larger. You have clindamycin phosphate is your generic name. You have 900 milligrams, so it's equivalent to 900 milligram, and it's saying that this is a 6 ml vial. And where's the expiration date? There's the expiration date. Again, it's purposely erased in this case. So again, this is the trade name, Cleosin phosphate. Your generic is clindamycin. The dosage units are milligrams, right? So this is the dosage. Administration unit comes in ml. So what's the concentration? So the concentration is 900 milligrams. So there's 900 milligram per 6 ml. So this is 6 ml vial who has 900 milligrams. So that's your concentration. Now let's move on to section D, medication administration equipment. So various pieces of equipment are used to administer medications depending on the drug and route of administration. Knowledge of the appropriate choice and use of this equipment is essential to correctly administer these medications. These are your objectives. Please read them carefully. And here are your assignments. So you have optional reading, your Med Math textbook, Chapter 3, pages 73 to 85, as well as Chapter 10, pages 399 to 414. Also, make sure you do your Section D ATI Med modules assigned in Canvas. So this right here is your insulin syringe. So don't get confused. Don't confuse the insulin syringe with your tuberculin syringe. They're very similar, but you have to pay attention of the units of measurement. So that's one thing. So on a insulin syringe, you have units. Meanwhile, on your tuberculin syringe, you have ml. And a lot of the manufacturers now, they actually indicate in their packaging as well as in the syringes, and it says on their insulin or for insulin use. So make sure you pay attention to that. A lot of the times they're also color coded, but you can't always rely on the colors because those can change. So really just pay attention whenever you're getting your equipments. It is very important to know the difference of like the different equipments that you're going to use, because that can actually lead to a medication administration error if you happen to use an equipment that's not usually used for that specific medication. So this is an illustration of an insulin syringe. This is usually how it looks like. All right, so this is an actual picture of it. Now this is how a tuberculin syringe looks like. They're very similar looking, so be very careful. This is an illustration of a tuberculin syringe, and this is one without the needle. So you oftentimes they have a needle attached to the syringe already, but there are times that it's by itself. So this is a 1 ml syringe, and it says there 1 ml. Over here you have your oral syringes or enteral syringes, so don't confuse them with your insulin syringes or tuberculin syringes. These are not designed to administer anything intravenously, intramuscularly, etc. So these are for oral or enteral purposes only. Again, a lot of the times they're color coded, but sometimes depending on the manufacturer, the colors can change. So don't rely on that completely. Make sure you're reading the packaging, you're reading the labels. So again, this is an oral or enteral syringe. On this side over here, you have your 3 ml syringe. This is an illustration, and this is an actual picture of a 3 ml syringe. So over here, you have on the top part, you have a calculated medication spoon. And then on here, you have the oral syringe. And then at the bottom, you have your calibrated dropper or safety dropper calibrated in milliliters. So this is a dropper used, and a lot of times these equipments are used for pediatric medication administration. Over here, you have on top illustrations of medication cups or med cups, and at the bottom, they're actual pictures of med cups. Depending on the manufacturer or which side you're looking at, a lot of the times they have markings for mLs and tablespoons. Sometimes they only have markings for mLs, and occasionally you can also see the ounces. So make sure you're paying attention to how they're marked, and please read about how to properly measure liquid medications using a med cup. Know where your meniscus is. So the meniscus is the bottom of the curved surface of a liquid in a cup container. So if we were to pour a liquid or medication here, you will see like a curved. So you're gonna use the meniscus to measure it. So you don't use the higher part. You usually use the bottom curving of that liquid. And it's also very important to measure the medications at eye level. So here, let's try to calculate oral medication. So first example, so we have an order for azithromycin oral suspension 400 milligrams PO daily times 4 days. Now this is the label that we have. So this is a 30 ml mixed. We have Zithromax, which is your trade name. We have azithromycin, which is your generic name. And you have the concentration over here, 200 milligrams per 5 ml. Now, I always like to start by writing my formula. So let's do this. Let's exit drawing here, and let me put the whiteboard nearby. So over here, this is my desired dose times supply. So how is it supplied? And have. So my desired dose is 400 milligrams times my supply dose it's supplied in 5 ml. So for each 5 ml, I have 200 milligrams. So again, I want to circle what I want. So this is what I want. Okay, so I'm going to go on. We cancel this and this, right? And we multiply the numerator with the numerator. So I have 400 times 5. So what's 400 times 5? You have 2, 3 over 200. Now I have okay 10, and again lastly we want to write down the label. 10 of what? We want 10 ml. So that's our answer over there. So we need to administer 10 ml in order to have that 400 milligrams. So next, let's take a look at this next order. So the physician or provider ordered digoxin elixir 500 micrograms PO times 1 now. And this is our label. Now, what do we need in order to know how much we will administer? So, in order to know my numbers or how much I'm gonna give, I need to calculate, right? So again, the formula is desired times supply over half. So desired is a doctor's order. So I have 500 micrograms, and it's multiplied in supply. So this specific medication comes in 2.5 ml. So it's going to be 2.5 ml. Now, this one also comes in 0.125 milligrams in dose. Well, if you look at this, you can cancel micrograms to milligrams. So we need to calculate for the conversion. So instead, we will write it this way. Bear with me. So we have 500 micrograms. I had to write a little smaller. Times, okay, it's 1,000 micrograms, 1 milligram times 2.5 ml over 1.25 milligrams. And what do I need at the end? I need it to be an ml. So I want to circle that just so it reminds me. Okay, now I want to multiply the numerators. So what do I have? So I have 500 times 2.5. So I have 1,250 over the denominator, which is 1,000. I forgot to mention we've canceled these ones out, right? Because they cancel each other. So we have 1,000 times 0.125 is 125. So we have 5, right? So now we're gonna divide the numerator by the denominator. So 1,250 divided by 125 is equal to 10. So how much are we going to give? In order to give 500 micrograms, we're going to give 10. Don't forget about this. It's 10 ml. 10 ml. Alright, you guys can practice on the other ones. So you have the order for furosemide 34 milligrams PO daily, and the amoxicillin oral suspension. So practice on that one. And let's do another last example here. So you have an order for potassium chloride 15 MEQ PO times 1 now. This is your label. So let's see, what do we need? So first we write the formula. Again, it's really nice to write the formula because it reminds you on how to, where to place each value and what values do you really need. So first, I'm going to figure out what's my desired. So my desired is really what did the order say? What was ordered? So we want 15 MEQ. So I'll write down 15 MEQ times supply. So if I look at the label, it's supplied in 15 ml. So that's how it comes. That's how I'm going to administer it. 15 ml. And how much is in each 15 ml? So that's what I have, right? So to know what I have, I want to know how much is in 15 ml. So it says here there's 20 MEQ. 20 MEQ per 15 ml. Now I want to know what unit I'm going to be using or label. So for this one, I want to know my ml. So again, we're going to multiply our numerators and then multiply our denominators. So 15 times 15, we have 225. 225, and then we're gonna multiply our denominator. So this is a given, right? So usually if there's no denominator, it's usually a 1 there. So that's a given. We don't even have to write that down, but that's just a reminder for you guys. So over 20. So now we have our numerator and denominator. We want to divide. So let's divide 225 divided by 20. 225 divided by 20. So in this case, how much are we gonna give? So for this one, the answer is 11.25 mLs in order to give 15 MEQ. So is this our final answer? The answer to that is no, because if we recall our rounding rules from section A, if a liquid is greater than 1 ml, we round it to the tenths place. But since this one is greater than 1 ml, we want to make sure that we round it to the 10th ml, and this one is on the hundredths place, right? So when we look at this number, do we round up or do we round down? So we round up if it's greater than or equal to 5. So is this greater than or equal to 5? Yes, it is. So our answer to this, our final answer to this question would be 11.3 ml. All right, guys. So please work on your practice problems, and then we'll go over it in class. So please also answer section C and D example practice. Make sure you're practicing, because this is really how you're going to learn it. This is how you're going to perfect that. You have to practice. Anyway, I'm going to go over the first example with you guys. So if you guys can finish the rest of the problems, and if for some reason you're having a hard time, definitely let me know and we can go over some of them in class. I'm also going to release the answer keys once you already answered them. That way you can check and see if you got them right. So for this medication, we have Ciclor or Cefaclor. So the order is Cefaclor 500 milligrams PO every 8 hours. In this one, so it's asking us a few questions. It wants to know what is the trade name. So what's the trade name for this. So the trade name usually, so over here, this is your trade name. So trade name is Secor. Now, what is your generic name? So generic name is usually under your trade name. Generic is your Cefaclor. Oops, Cefaclor. And what's the route? What's the route? Right? It says here too on the label. So route is PO, or you want to write it down, oral. What's the supply constant or concentration? So the supply and concentration, so it comes in 250 milligrams per 5 ml. So how much are we gonna administer? So let's calculate now. So let's see here. So again, I like writing my formula, which is the desired times supply over have. So the desired is my order, right? So my desired is 500 milligrams times the supply. So this is supplied in 5 ml. So that's how it comes. It comes in mLs, in 5 mLs. Now, in that 5 ml, what's the dose, right? How much is in it? So that's our have. So in 5 ml, we have 250 milligrams. Okay. So then now I want to know what's my label, or what do I want? How do I want to administer it? So I want to administer this in ml. So you want to circle that, and also this cancels each other out, right? Now you multiply your numerators. So you have 500 times 5. You have 2,500 over 250 times 1, 250. So you divide 2,500 divided by 250. Your answer is 10. 10 what? Remember? 10 ml. So this is what I'm going to administer. I'm going to administer 10 ml of this medication in order to give 500 milligrams. So again, please continue, answer the rest. And let's see here. Oh, let's actually answer this together before you answer the rest, just so you know how to answer this in the future. So if this is my medication cup and I said I need 10 ml, I'm gonna line here, right? This is how much I'm gonna give, 10 ml. Now in real life, it's not gonna look like that, right? So let me, oops, I can't erase that. So exit drawing. So usually your liquids are gonna look like this. It's gonna be curved, and you're gonna measure it here in the meniscus, the lower curve. That's the meniscus. Anyway, please continue answering the rest, and I'll release the answer keys so you can check which ones you got right, which ones you got wrong, and we can go over some of them in class.